Hi, everybody. Thank you guys so much for joining us today. My name is Sarah Kirsting, and I am really excited to get to introduce your two speakers for the symposium. Today, we are thrilled to be announcing and introducing you to Severity Index, which is the world's very first objective visual field loss staging powered by AI and machine learning, and it is brought to you between Carrot partnered with Eyelomics. This is the very first time anything like this has ever been built, and so I'm excited to be able to share it with you guys today. First, a couple of quick introductions. I'm here just as your moderator, so that is all I'm here to do. I am not the expert. I am not the doctor. I am not the professor. So I'm going to hand it over to the experts here in a second. But I am the VP of Marketing at Carrot. We are the world's leading VR visual diagnostic platform. But I'm thrilled to be partnering today with a team from Eyelomics. We have Dr. Rehan Ahmed and Dr. Siamak Yousefi. Both of them are going to give us a little bit more information about Severity Index. But do you guys want to say hi and introduce yourselves real quick?
Hi, my name is Rehan Ahmed. I am CEO and a practicing ophthalmologist at Eyelomics, based in Texas.
Hello, my name is Siamak Yousefi. I'm Associate Professor with Bascom Palmer Eye Institute, University of Miami, and I'm part of Eyelomics.
Excellent. Well, a little bit about Carrot before we get started. You guys might remember our name, Virtual Field. We recently went through a rebrand. So if you have not heard of Carrot, don't worry, it's because it's brand new. Just a few months ago, we changed from Virtual Field to Carrot. But we are not new to this industry. We have been running VR visual fields and other visual tests since 2018. We are actually the inventors of the technology, the very first people to ever put a visual field test inside of a VR headset. And we are by far the market leaders with more than 5 million visual tests completed using a Carrot device. That's more than 70% of the entire market that exists here. So by far the leader in this space, but we've come a long way since the very first visual field we ever put into a VR headset. In fact, we have over 15 exams you can run, including neuro, EOM, pupillometry, color vision, contrast sensitivity, and a lot more. We also have a lot of workflow automation features, integrations, and great interoperability with your EMR, EHRs, direct syncing, analytics dashboards for our utilization, and a lot more. So I don't want to bore you with this. This is not why you guys are here today, but that's your quick little blurb here on Carrot. We are thrilled to be bringing this great, awesome new feature to the market here. Very first time. This is the first time we are announcing it here. So we're so grateful you guys are here with us. I'm going to hand it over to Rehan, who is going to take it from here, and he's going to talk to you guys about Severity Index.
Hey, thanks, Sarah. And Sarah, just to sort of piggyback on what you were saying, I am a happy Carrot user even before this partnership, which I'm really proud to announce. I've been using it for 2.5 years, and our old visual machine is just sort of gathering dust right now. We really like the portability and the presentation of the report. So really excited to be talking to you guys about Severity Index and introducing Eyelomics. And this is a company Siamak and I started. And our primary goal is to make a glaucoma intelligence platform and to create and deliver actionable data in terms of glaucoma and to provide a data-driven sort of approach to make something that's subjective objective. Sarah, could you hit the play button one more time? So so I really love Carrot's reports. I think they're fantastic. They're color coded. They're nice. It's not like those old scroll that you'd see from the other devices. And they're color coded. And we have here now showing the severity index of an example patient. And we're going to go through that and why this is important and why we think this provides yet another aspect that can help clinicians in the context of the entire patient picture to help guide diagnoses and treatment. So next slide. Yeah, so just to take a step back, and you can move over to the next slide. The current problem is that glaucoma staging today is truthfully inconsistent. And just sort of looking at a 40,000-foot view, what is our primary role in treating patients with glaucoma? It's not to control their IOP necessarily, although that is a main goal of ours. It's to obviously protect the nerve. But ultimately, we care about the visual field, right? And the best way, the gold standard, is with formal visual field testing. But the systems that we have are subjective, and they have really been based on thresholds that were defined decades ago, probably in like a smoke-filled room 30, 40 years ago. CMAC, you may know the stories of we're going to go through the HPA here, which has led to, even among specialists, agreement on staging is limited. And I would say that, two clinicians reviewing the same result can reach different decisions. That's definitely true. I would even say that the same clinician at a different point in time, looking at the same visual field, may just reach a different decision based off that particular, that day, that fact pattern. And the problem is this leads to inconsistent treatment, inconsistent referral patterns, just challenging patient outcomes because it's hard to separate, and this is a core idea, it's hard to separate the signal from the noise when you have so much data. And this is becoming a problem, and it's becoming more of a problem. Of course, glaucoma is increasing, and we all know that. And we all know there are shortages of specialists and eye care providers to take care of these patients. And there's a third issue here too, is that with these devices, and I think this is a good thing in a way, is that we are getting more and more visual fields. Patients are going to be getting them, at home. I will sometimes ask patients to do visual fields more frequently because it's so easy. And this is actually aligning more with practice patterns that are coming out just to increase our frequency of visual fields. So we're having a data deluge. And so the problem really will be getting through that data in a consistent and reliable way. And this is where the severity index plays a really important role. We go to the next slide. So our goal at Eyelomics is to, as I mentioned, provide a data-derived alternative to what was before subjective staging. Go forward. All right, so I'm super excited to sort of get into the weeds here and talk about how the severity index automatically assigns one of 4 objective severity stages. Now, this is not their disease severity. It is the severity index of their visual field. Of course, their disease is a constellation of multiple factors like their nerve, their pressure, their clinical picture, family history. This severity index is important. It's just about the visual field, which is, as I mentioned, the most important parameter in someone's glaucoma progression. And the 4 categories are normal, mild, moderate, or advanced in terms of the visual field. And this is just it's a severity assessment that, as I mentioned, is independent of it's objective, right? It's based on data, and it provides a consistent way to look at that. And CMAC will go through how we came up with this, the data behind it, and why we think it's very supportive in helping clinicians take care of patients. Move on to the next slide. CMAC will talk about the science here, which is vast.
Sure. So now let's go to see, as Rihan mentioned, this data-driven model, how it works. So basically, it's based on 2 stages of machine learning. The first stage is unsupervised. 0 human expert labeling means that everything is learned from data itself. So we used over 500,000 visual fields, and then from that we selected close to 50,000 visual fields from 50,000 eyes across the spectrum of visual field severity, means from pretty much normal all the way to end stage glaucoma. And then we used a K-means clustering. What is this model? This is a model which is unsupervised. Again, there is no human expert intervention to make it biased. And it just automatically finds interesting patterns in the data and then puts them together in different groups and clusters. We call them clusters. So K-means identified 4 clusters, again, automatically without my interference or any other expert. And then when we had a look at the characteristic of patients in these 4 groups, we noticed that, those one group pretty much mostly normal in terms of visual field, and then one group just falls in the mild category, and then moderate, and then advanced stages. So we pseudo label them as normal, mild, moderate, and advanced stages. And then the number of groups, again, it was automatically and absolutely determined by the model based on a number of objective metrics. No interference. For example, I didn't say the model, go ahead and find 4 groups. The model found 4 groups by itself. And then when we said that, okay, so how this is then consistent and reproducible, we repeated this a number of times, many times actually, with randomly selected subsets, and then repeated the clustering, and then identified that, oh, over 99% of the time, everything is absolutely consistent and reproducible. Then we said that, okay, perfect. Now we have 4 groups. How to make it easier and then actionable for optometrists, ophthalmologists, or any user of the headset devices? We develop another stage, which is supervised model based on a Bayes minimum error classifier, which actually is a classifier that finds the best threshold for separating 2 different classes and groups. And then the result was a precise, absolutely data-driven thresholds that we identified. So now what is the outcome over here? We have one fixed algorithm. If you put the same result, no matter how many times, you get consistent and exact same outcome. And then this is absolutely based on data. There is no generative, there is no hallucination. So everything is learned based on the data. So next slide, please. So these are the 4 groups that I just talked about, and these are the very important thresholds that we came up with: minus 2.3, minus 9.6 dB, and then minus 17.3 dB, that separates these 4 groups. And the model is based on these thresholds. It can tell what is the severity stage of the visual field. Next slide, please. So you may wonder how it compares with Hoda Parish Anderson, great colleagues of mine back in Bascom Palmer Eye Institute. Next slide, please. So to just summarize it quickly. So Hadi Parish Anderson, first of all, it generated 3 stages, not 4. We have generated 4 stages of visual field severity. Second of all, it was subjective and based on expert consensus. Third, they were unable to analyze 500,000 visual field that we had. It's absolutely impossible for humans just to sit down and then analyze 500,000 visual field, but the AI can quickly do this. Next slide, please. So I think this is
Yeah. So what was different before and what has changed now? So with the HPA, and this is what I mentioned about the 3 specialists in a smoke-filled room. So before, they had mean deviations of -6, -12, -18. That was sort of, putting your finger up in the wind and seeing what you come up with in terms of categorizing disease stages. Here we have come up with AI-based, validated, specific thresholds for the Carrot device. So it provides a significant level of validation and consistency over what was before. And you go over to the next slide. So as a Carrot user, I'm super excited, Sarah, to go in on Monday and to see how this actually looks, because there are no new steps that actually I have to do. My tech or myself, when I put the device on, they complete the visual field as normal. I mean, there's no change in flow. There's no other extra buttons I think that, that you have to put in. And you review the report as normally in the context of their entire, clinical presentation. And then you have an additional piece of information that you can help and you can use to give you some more confidence in their exact disease staging. I'm super excited about this, especially getting reports from my colleagues and seeing, and knowing that there's reliability and validation behind this. It does not provide diagnosis. It just assesses the visual field severity. Of course, as I mentioned, diagnosis still depends on context, imaging, pressure, physician judgment, etc. as Siamak mentioned, this is not Gen AI, right? You're not going to get hallucinations. One day it's not going to say severe, and the next day it says mild, or stuff like that. It's not running on new data. It's not actually analyzing the images. It's using predefined MDs that will come up through the method that Siamak had mentioned. It's secure. It stays entirely with the Carrot platform, and of course, it does not replace clinical judgment. And this is scientifically grounded. We are super excited, Siamak, to be presenting this at the American Academy of Ophthalmology meeting coming up, and continuing to build on this framework.
Awesome. Thank you guys so much. I know we are a couple seconds over here. We would love to talk to you more about Severity Index. If you guys want to reach out to us, you can scan this QR code to see a full demo or even get a free trial where you can try this in your clinic completely free. Not a single dime will be charged to you. We would love to talk to you more about this. This is game-changing stuff. Honestly, Carrot is thrilled and honored to be partnered with Eyelomics on this one. This is just, it is forever going to change the way that we stage visual field severity. And who better to do it with than the leaders in glaucoma intelligence at Eyelomics and Carrot, the world's leading visual field testing device. So thank you guys so much. I really appreciate it. If you guys have questions, scan that QR code. We would love to talk to you soon.